Good evening and welcome to Edu Skills OET MEDC. Today again, we are into skimming and scanning skills, which is going to be useful for all the subtests, all the four subtests, and especially in reading and listening. And again, we'll be dealing with the reading part here today. If you're watching this on YouTube, kindly consider subscribing to the channel. Give us a thumbs up if you like our work and share to your contacts so that we reach out to maximum number of OET aspirants, especially those who are emotionally and financially struggling to crack OET. All our services are absolutely free and there is no payments of any sort. OET skills, reading part A. Again, we are going with total knee replacement. 9 steps, identify 4 text headings and write down on a piece of paper. I'm not going to explain those things. We have already seen in the previous sessions. If you have not watched the previous sessions, please go to EduSkills OET YouTube channel. You will find them there. Number 1, you have to identify the 4 text headings and write down on a piece of paper or on your notebook. 2, understand the sequence among the 4 text headings. Write the 4 text headings on top of each page. Skim the 4 text, highlight the clue words. Title, section headings, subheadings, names, number, percentage, sequential expression, frequency expression, scale, abbreviation, list, or the conjunctions. 5th one, match the 20 questions, statements with the 4 texts. Scan the text to locate the answer. Write the answers in the answer booklet. Proofreading, filling the self-assessment form. Method for reading part A, TQT method. TQT method means text, question, then back to text. First, we will skim the text, then we'll go into analysis of questions. Then we return to the text to scan the text to locate the particular answer. Identify the 4 text headings. Total knee replacement is the common heading. Don't take it as a text heading. Then you have first one, we are given definition as the heading. Second one, clinical assessment or just assessment. Third one, text C, complications. Text D, post-operative care. Now step 2, understand the relationship and sequence among the 4 headings. So, the main heading is total knee replacement. The text A describes and defines total knee replacement procedure. Then text B speaks about the clinical assessment. Text C speaks about complications, and text D, post-operative care. There is a sequence here. Assessment, complications will not be given before assessment, or complications will not be given in assessment. So all the complications will be in text C. Step 3, write the 4 text headings on top of each page. Okay. On each page, you have to, like this, on top, write down the 4 text headings. And, this is how we write. Yeah, that's cool. So you have all the 4 headings. Total knee replacement is the main heading. And first one is definition or description, whatever you want to say. Okay, second one is clinical assessment, text B. Text C is complications or potential complications, whatever. This is only for your understanding, nothing to do with the OET exam, okay? This is to gain competency. After gaining competency, none of these steps are required. You will simply swoop into the things and simply the answers will blink like bulbs and you will immediately write. Okay, text D, post-operative care. Yes, so cool. So let's see if you can glance over what is supposed to be highlighted.
Names.
Okay. Yeah, total. Yeah, this is both name and abbreviation. Okay. Then
Numbers.
where is number? Artificial joint, organ, body part, right? Yes.
Damage.
Cartilage.
Damage, cartilage and bone. Yes.
Knee joint.
Again, yes.
Yes.
Knee joint is
Osteoarthritis.
Rheumatoid arthritis.
Osteoarthritis. That is name of the condition.
Rheumatoid arthritis. Knee
Knee
deformity.
Rheumatoid arthritis. Yes. Then
Medication, physiotherapy, and lifestyle changes.
okay, medication, physiotherapy, and lifestyle changes. They come under treatment. Our clue is treatment or intervention. This is procedure. Small operations, procedure. Name of it? Procedure. Okay, debridement. Okay. Yes.
Partial knee replacement.
Okay, partial knee replacement, PKR. Abbreviations are important, I said. Abbreviation and name together. When there is abbreviation and name together, very, very important. Okay. Then,
Full joint replacement.
then,
20 years.
60 and 80.
but with this, you can have all the answers. Is that cool? So the skimming is done. See, name of a procedure here, total knee replacement. Then name of a body part. One is knee joint. Second one is damaged cartilage. Another one is bone. Then name of a disease, that is osteoarthritis and rheumatoid arthritis, knee injury, all those things.
Injury, knee deformity.
Again, name procedure. Okay, that is partial knee replacement and mosaicoplasty. Yes. Then sequential expression here, first choices. Then you have abbreviation PKR. Here also you have TKR. Here you have PKR and TKR. Let's see whether they will be the answers. Time expression, 20 years already you said. All these are mentioned by you. Numbers 60 and 80. So this is the idea. This is how you have to write down as you go on reading. Write down these things with a different color pencil or pen in on your hard copy. Okay. And put all these arrow marks, circulate, and whatever you can do. Step 5, match the 20 question statements with the 4 texts. I will match now this particular text. And out of 20 questions, you have 6 questions from this one text. Okay. And we will see whether we have highlighted the answers. We never knew the questions. Now, could you tell what is important in the question?
Smaller
operations.
Then, what is total knee replacement? Where is it given?
A.
Smaller operations? PKR? TKR? The parts of an artificial knee joint may be held in place with dash. Okay. See, or new bone growth we have highlighted. Okay. Then dash and lifestyle changes are the first choices for. Again, it is. So easy it is. But these are taken from different questions. These are the 3rd question, 7th question, 9th question, 12th question, 17th question, and 20th question. And here, smaller operations and alternative to knee replacement is answer is a name, procedure. We can also say pet name or alternative name. What a total replacement is, name, disease or condition. What do the initials PKR stand for? Again, name, disease, condition. What is the main reason a TKR is carried out for? Name, disease, condition, and scale is there. Then the parts of an artificial knee joint may be held in place with dash or new bone growth. Name and conjunction or list. As I said, if there is a list, that will be the answer. Here also again list you have, 2-3 things you have. Medication, then there is something else, and lifestyle. Yeah, physiotherapy and lifestyle changes are the first choices for managing the knee symptoms. Conjunction or list. Whenever there is a list, I told you there are 2 lists here and 2 of them are the answers. If there are 3 items, 1 will be the answer or 2 may be the answer. 2 words. Okay. Now you know all these are from text A. Now step 6, scan the text to locate the answers. Okay. This is 3rd question. Smaller operations has alternatives to knee replacement. And where is it? Smaller operations here already highlighted, right? Smaller operations. Yes. So cool. 7th one. What a total knee replacement is?
The first line.
First line. Yeah. What?
Line.
Yeah. Surgery is a major. Yeah. Second line. So it is there. It's just to tell which text contains it. So cool. Okay. What do the initials PKR stand for? What is the full form of PKR? We have already highlighted. And where is it? He is a partial PKR. Already, if you highlight by PKR, that's more than enough. Okay. Or PKR is an answer. TKR is an answer. Okay. Then 12. What is the main reason a TKR is carried out for?
Osteoarthritis.
Fifth line.
From the surface of the knee joint.
Yes, osteoarthritis is the main reason.
Main reason. Okay. Main reason also scale is there. Later we will learn. But then I just want to tell you with these simple clues, you can find almost all the answers. 17th one, the parts of an artificial knee joint may be held in place with dash or new bone growth. Again, a list. Where do you have?
4th line.
Yeah.
With Cement or newborn growth.
Yeah, cement or new. Yeah, cement is the answer. Cement or
Cement.
newborn growth.
Newborn
That is
growth.
again list or another thing or conjunction.
Or
Yeah, 20th one. Dash and
Physiotherapy
lifestyle
and
changes are the best.
medication and
Yeah, see medication, physiotherapy. I left medication to be highlighted. Physiotherapy and lifestyle change. Medication and physiotherapy is the answer, and lifestyle changes. A list of 3 things. 2 words are the answers. How beautiful, how simple, how beautiful. Provided you have patience and practice, it becomes so easy. You need not go into any steps once you are competent. As you just glance through, you will have all the answers. With this one text, you have 60 marks, right? That can be within these 6 questions. You don't require even 2 minutes once you are competent, because immediately you will know the answers. Where is the answer? 7th, write down the answers in the answer booklet. You have to write down in the answer booklet. 8th, proofreading, I said, very, very important. Don't neglect it. Even during your practice, do it. Then only you will develop that skill of proofreading. Identify if there is a spelling mistake, or you might have written a repeated word or anything. Check it. Take time and check it. Then fill the self-assessment form. Well, later we will introduce into that. Yeah. Now let me know what are the things you have to highlight here. Clinical assessment.
Anesthetic and rehabilitation. It's the name and there is a conjunction there.
Okay. And
X-ray.
Then something like that. You will know ensure means must. That's modal verb. That's a clear signal to the answer. Okay. Next one.
X-ray.
X-rays. Okay. X-ray test. Yeah. Name of your test. Physiotherapy.
Mobility and gait.
Mobility and gait.
Okay. Mobility and gait. Okay.
Symptoms.
Symptoms and
Symptoms. Yeah. Check for symptoms. Yeah.
Pain, swelling.
swelling and stiffness.
Yeah. You know, you can pain, swelling, stiffness. All these symptoms. Knee joint. What is it? Knee joint. What is knee joint? Body part. Body part. Name of the body. Then mobility. Mobility. Then
Locking and clicking.
knee locking and clicking. What is special there? 10th strategy. 10th strategy. Conjunction is important. You say indication to answer. Inability to straighten the knee, interference with the quality of life and sleep, difficulty with or unable to carry out everyday tasks such as shopping or getting out of bath. Yeah.
Feeling depressed.
Everyday tasks can be highlighted. Okay. Then
Such as
feeling depressed can be, depressed is a symptom, right? So these are the things we are highlighting. This is known as, what is this skill? Skimming. Make sure first step is skimming. Okay. Skim the 4 texts. That's what we are doing. Skim the 4 texts. That's what we have done. So it looks like this. Okay. I've highlighted even more with clarity. One more we left here. What is that? Difficulty or unable to carry, or is that right? Yes. Okay. So cool. So that is it today. Text B. Next one is text C. Now come on. Infection and blood clots. Yeah. Infection and blood clots. What is there specially?
Symptoms.
Symptoms
is there.
Most common complication. Yeah, then most is there. We have not taught through the new batch, but don't worry, I'll be teaching you. That is very important. Scale, that's a clear indication. Then potential complications. Okay, first you are supposed to highlight this, right?
complication.
Potential complications or complications, both you can highlight as well, no problem. That's very important. Side heading. Okay, text heading. Yeah. Then
antibiotics.
Antibiotics. Okay.
But modern work.
Contrast.
Then
in rare cases,
further surgery.
In rare cases, yeah, scale is there, so it's an indication. Yeah. It may is a modal verb again, another indicator.
Operated leg.
Artificial
Okay.
knee joint.
Push.
Artificial knee joint.
Artificial knee.
What else?
Big.
Bleeding.
Bleeding, unexpected.
Ligament, artery, or nerve.
Nerve.
Knee joint. Knee
Fracture.
joint.
That's another name
Knee joint.
of a disease.
Father, hot, redness,
Chest
Chest
pain.
pain.
Hot,
Chest-
red, hard,
chest
or
pain.
hot, redding, hard or
Symptoms.
painful.
Expression hot, red, and hard and painful is symptoms. I'll say a list of symptoms.
Symptoms.
List of symptoms. Then anything?
Pain.
Excuse me, Father.
Yeah,
After
please.
surgery, further surgery also sequential, Father.
After surgery, right?
After surgery.
Yeah, after surgery. During or after surgery.
Excess bone
Okay. Then
Restricted.
scar tissue.
Scar tissue.
Kneecap.
Kneecap.
yeah, okay.
Numbness.
Yeah, these are the complications we highlighted. That doesn't mean all the things highlighted will be the answers. If there are names of 4 medicines, maybe one will be the answer, right? But then it gives us an easy way to locate. D, C, we have highlighted. We are not going to do it together. We have highlighted opioid analgesia. What is this? First to highlight. What clue is this?
Name.
Name.
Name of
Name for
A drug.
drug. Yeah. Okay. Then you have abbreviation. Then you have numbers 24 to 48 hours. Okay. Duration. Then deep vein thrombosis is name again. Condition. Intermittent foot sole pump is a name of the equipment. Then again you have 12 to 18 hours. Number. We have CPM machine. Name, abbreviation, name. Okay. So beautiful. And coming to the timeline to full recovery, post-operative care following knee replacement. What type of analgesia? See, PA, CAS. Whenever there is abbreviation, there is an answer. So easy it is. And you see the name of, see what is the minimum knee bend the patient should have on discharge from hospital?
90 degree angle.
90 degree angle.
Yeah. Where is it? 90 degree?
Discharge.
Okay.
Down for.
Yeah, 90 degree. Yeah, 90
Yes,
degree.
90
See,
degree.
that's a number. That's a number, right?
Yes, sir.
Again, deep vein thrombosis is a name. Prevention options includes use of dash pump. Name of a pump.
Intermittent food salt.
Intermittent.
That's all you find. You don't find many other names. Yeah. Then you have on discharge. When you know on discharge, at discharge, immediately
Yes,
you
sir.
go there. You don't look anywhere here. Immediately you go to discharge. On discharge, most patients are able to walk dash and go up.
10
And
meters.
10
you know,
meters.
that's while reading, you know, it must be a distance. So 10 meters, again, it's a number. It's a distance number. So exactly, not once and text, every text gives the same idea. How sweet and wonderful if you just dig into it. You know, see, post-operative care heading or title, and opioid analgesia, name of a drug, and intermittent food, sole pump, name of a device, then subheading or side heading or sequential expression here at discharge, then again number, 90 degree angle, 10 meters number, timeline to full recovery, subheading or side heading at the end. Yeah, so beautiful. See, timeline to full recovery. Then there is a big table you don't require to look into at all. People don't get time because they will be searching everything here. Because there is no question regarding these table activities. Only the heading of the table, time to full recovery, that is mentioned. That too, just to match the paragraph. So these are the answers. So cool. Second one comes for timeline for full recovery. That is the last heading, second subheading. Then operational care following knee replacement. That is D. Again, that is the heading. And type of analgesia, the PCAS. Okay. And on discharge, 90 degree angle, interval full surround. Again, I'm telling you to tell you this is the thing. Nothing else. You have to practice this. Search for these things. Those are the answers. You don't even look into the questions. Once you're competent, 99% you will have the answers without looking into the questions. And usually with the great batches, what I do, I give them a task to create questions. highlight the clues. I won't give them the questions. I will give only 4 texts. Then I ask them to create 20 questions. Do you understand?
Yes.
Yes,
And I
Father.
tell you more than 15, 16 will be right. They will have done the same thing because you know what is going to be the answer. Those are the only questions they can ask. Those are the strategies. Or in your language, those are the tips. Okay? And always, this one you beware, write it again. Always think, most of them will lose their score in these problems. Copy and paste your answer from the text. Again, there are concerns being asked. That's why I'm repeating. Copy and paste means you can't change anything. When you copy and paste, nothing changes, right? So exactly what is given in the text, nothing else, extra or less. You can't remove anything, you can't add anything. Fill in the blanks, no repetition of words that I have explained. And see, like pump, you can't write. Okay, depending from its prevention options include use of dash and pump. Intermittent foot sole is the answer, not full stole pump. People will think it is so easy, so they will write in the answer booklet intermittent foot sole pump. That is wrong because it repeats here. Pump it will become. Okay, that is wrong. So answer should be only intermittent foot sole. The doctor advised her a dash test, not a blood test. Blood test is wrong. Answer is blood test, but your answer must be just blood because test is given after the gap. Otherwise, when they read, it will read like the doctor advised her a blood test. Doubling, we call it. Doubling is a mistake. Normally, we don't remember. That's why I said proofreading is important. Okay, check out these things. When you have such things, maybe blood, you don't understand. You just check what is there after the blank. Make it sure. If it is blood test, make sure test is not there in the question booklet. Okay. Now missing words. Okay. 90-degree angle. 90 degree is wrong. What is the minimum knee bend a patient should have on discharge from a hospital? People will write 90 degree. Oh, correct. No. 90 degree doesn't give the meaning. 90 degree angle is the right answer. That's why people say exam was so easy, but I didn't get the required score. Father, exam was very easy. Problem is this. Very easy because you know the answer, you got the answer, you located the answer, but you did not write the answer properly. Okay, no typos. Typos means spelling mistakes. See? What is the mistake here? This is wrong.
Yes, Father.
Analgesia. A. Yeah, these are the important words. So one spelling mistake will lose you 10 marks. So opioid it is. Opioid. OPI. Analgesia. ANA, not ANE. Okay? Beware of those words. That's why I said proofreading is very, very important. Check with that text and the word. Already it is given in the text. Then how can we make mistake, right? So that's what I stress, copy and paste. Not even a single difference or a single spelling difference. Okay? 10 meters, wrong. 10 meters as it is given in the text, METERS. That is right. I think now B and C is the task, okay? B and C, task for you. I have already posted. Hope you have the materials.
Okay, Father.
So, God bless
Thank
you.
you, Father. Thank you,
Yeah.
Father.
Enjoy OET learning.
Thank you, Father.